We're now connected with the Indonesian Health Ministry of COVID-19 Vaccination Program Spokesperson, Dr. Ibu Siti Nadia Tarmizi. Bu Nadia, it's always good to talk to you.
Good afternoon, Kai.
Good afternoon. So how do you see this endemic situation, especially in Indonesia? Do you think that we are ready to change the status to an endemic?
Yeah, I think we are quite optimistic, with the current condition of the COVID-19 situation. Since the last wave that we have been faced, and currently most all the indicators of the pandemic response is getting better, and even is it's quite good. Yeah, if we seen the number of cases keep decreasing. Yesterday it was reported like 3,000, 4,000. Yeah, at least it's a very less number compared to the previous week that up to 10,000. And if we seen the bed occupation rate is same, we have a trend decreasing of the positivity rate too. Now is like 4%, is below 5% as the WHO indicator or the standard, and then the bed occupation rate is 8%, is less than 10%. So almost all the indicators already reach below or decrease number.
Ibu Siti Nadia, Dirza here. So a lot of students are now starting offline school or face-to-face learning. And the homecoming season or mudik is also approaching. And we have heard that public transportation between cities and provinces does not accommodate mandatory antigen or PCR tests. Can you please enlighten us on this matter?
Yeah, the current situation, as we've seen, the number of people already got vaccination is quite high in Indonesia. If we've seen, for example, for the children, up to 6 years, we've seen mostly is already reaching like 20 million, which already got the first shot, and the 50 million already got the second shot. If we seen the total population that has been provided, the first shot is like 166 million, and for the second shot is like 159 million. And we have started the third vaccination. It's now like 21 million. Despite this number, we are aware that from our current survey that like 86% of Indonesian population already have protection on their body, which we measure. There is a titer of antibody for COVID-19, and we know that at that time is 87% is not only from the vaccination, but some of they got from the natural infection. So with this condition, with the high coverage of vaccination, although it's not yet like 70% of the population, it's giving us quite a protection, and it has been shown during the third wave when we are facing the Omicron. Most people are get infected, but is without very less symptom, or sometimes they even don't have any symptoms at all. And within 3 or 5 days, the symptoms already gone, and most the laboratory testing already becomes negative, and it's very small number that end on to the need for hospitalization or even the death case.
Now, one of the concerns is now that we hear it's been a positive trend for Indonesia. How long do you think do we have to be consistent for the government to be confident enough to change the status? And also, we know about the variants Delta Crohn and Omicron, and you've mentioned before the subvariants, right? And you mentioned before that like 86% of the population here in Indonesia are already protected. Do you think that is going to affect our consistency in this positive trend that we have here right now in regards to the COVID-19 pandemic?
So it's really depends on us. Okay, the government already have some analysis that if we keep having a high coverage of the vaccination, at least we achieve 70% of the population already have got the complete vaccination, and even like 40% already have the third booster, with, of course, the strong implementation of the health protocol. At least we know that we is still emphasizing the use of the mask, and then social distancing, and then washing hand is still the main intervention for handling the COVID situation. While the testing and tracing is one of that we still encourage at the province and the district and even the cities level to keep the number as the certain level in order to detect if there is a potential new number that might be increased, and a potential to prevent a new cluster. With those conditions, if we keep the number of the infection rate are low, with high vaccination, with strong health protocol, we am sure that in the certain time, for example, like 6 months maybe, we are able to manage the pandemic, and we can start to have the precondition such as like the endemic situation.
Alrighty, thanks a lot, Ibu Siti Nadia, for clearing a lot of issues, especially during Ramadan and approaching Ramadan and the holy month. Thank you, Ibu Siti Nadia.
Thank you, Ibu.
Thank you.